Hello friends, welcome to Knowledge Bites. Friends, in this lecture I am going to teach you an important topic of subject ENT, and the topic is Serous Otitis Media. Friends, before starting this chapter, I recommend you to please look upon the previous lecture which is on Acute Suppurative Otitis Media. Then you should come to this lecture. Serous Otitis Media is also known as glue ear. Glue ear. I will tell you this why it is known as glue ear later on. And it is also known as secretory otitis media. Secretory otitis media. Or it is also known as otitis media with effusion. Now the question is, what really happens in serous otitis media? In serous otitis media, sterile fluid. This sterile fluid gets accumulated in middle ear, gets collected in middle ear. I will tell you about this sterile fluid later on, so I have marked it here only. What are the causes of serous otitis media? Firstly, you should know that in ASOM, the collection of exudates occur in the middle ear. But if that exudates persist in the middle ear for more than 12 weeks, then acute suppurative otitis media complication will increase and it will now become serous otitis media. Okay, so now what are the causes of serous otitis media? First cause is decreased drainage. Decreased drainage of fluid. Why there is decreased drainage of fluid? So look upon here, this is the middle ear. This middle ear is attached to tympanic membrane. This is middle ear and this is tympanic membrane, and this tympanic membrane opens in nasopharynx. Okay, the secretions which is formed in the middle ear gets drained into the eustachian tube, and from eustachian tube it will ultimately drain into the nasopharynx. But suppose if a case happens that this eustachian tube is closed, so now if this eustachian tube is closed, the secretions which are formed in the middle ear will not be able to drain in the eustachian tube, and ultimately it will not come into the nasopharynx. So because of the closure of this eustachian tube, the fluids gets accumulated in the middle ear. The causes of decreased drainage means the causes for the obstruction of eustachian tube is because of two reasons, and these reasons are different in children and in adult. In children, palatine tonsils are present. This palatine tonsil gets hypertrophied, and the condition we know that it is known as adenoids. Because of these adenoids creates pressure on the eustachian tube, and because of that this eustachian tube gets closed and the fluid from the middle ear will not drain into the eustachian tube. Okay, so the most common cause in children is because of adenoids. Since palatine tonsils are impaired, so therefore the SOM in children are bilateral. Okay, so SOM in children are bilateral, but in case of adult it is not so. In adult, the most common cause of SOM is benign or malignant. Benign or malignant tumor, malignant of nasopharynx. benign or malignant tumor of nasopharynx. In adult, the SOM is unilateral, but in case of children, I have told you it is bilateral. Okay, why this SOM is occurring? It is occurring because of why this fluid accumulation is occurring. This fluid accumulation is occurring because of allergy. Because of allergy, there is increased production of the fluid in the middle ear. Okay, if the patient in ASOM, if it gets adequately treated, then the further complication of ASOM, that is the Serous Otitis Media, must not have occurred. So Serous Otitis Media is occurring because of inadequate treatment. Means the persistent effusion of ASOM is because of inadequate treatment, which is ultimately resulting in Serous Otitis Media. I have told you that the in middle ear sterile fluids gets collected. So now I will tell you what is this sterile fluid, how this sterile fluid is coming. This sterile fluid is coming because of the formation of biofilm. Now you will ask, what is this biofilm? This biofilm is produced by bacteria. Bacteria produces matrix of polysaccharide. This matrix of polysaccharide is the biofilm. It is the biofilm. This biofilm, that is the matrix of polysaccharide, allows passage of nutrients and fluid, and it produces favorable environment for bacteria. So the biofilm aggregated bacteria are not free floating in fluid. Biofilm aggregated bacteria are not free floating in fluid. They get sequestrated on the surface lining mucosa. Therefore, fluid in Serous Otitis Media are sterile. Now we will see the clinical feature of SOM. Clinical feature of Serous Otitis Media. In children, if there is decrease in hearing, then there will be delayed development of speech. Delayed development of speech. If the child will not be able to hear, then how the child will be able to learn speech, sorry. And because of delayed development of speech, there will be difficulty in learning. Therefore, two problems will occur in children: delayed development of speech and difficulty in learning. In children, SOM is bilateral. I have told you why it is bilateral, because of adenoid, and the hearing loss is fluctuating. Fluctuating hearing loss. Why this fluctuating hearing loss is occurring? This fluctuating hearing loss is occurring because sometimes the fluid from the middle ear can pass through the eustachian tube. When the child cries, there is dislocation of adenoids, and because of that, sometimes that fluid from the middle ear can pass through the eustachian tube into the nasopharynx. So the drainage system sometimes it gets corrected for a while, and it is occurring. Why SOM is occurring? It is because of inadequate treatment of ASOM. Now on examination of tympanic membrane, it appears dull, retracted. Okay, and you can see the fluid and air bubble inside the tympanic membrane. Okay, and cholesterol granulomas formation occur. Cholesterol granulomas formation occur. Why this cholesterol granulomas formation is occurring? It is because serous fluid for a long time leads to the formation of cholesterol granuloma, and because of that tympanic membrane appears blue. I have told you previously why Serous Otitis Media is known as glue ear. Because of this, tympanic membrane appears blue because of the cholesterol granulomas, and therefore Serous Otitis Media is also known as glue ear. Now we have to investigate if the patient is suffering from Serous Otitis Media or not. Then the investigation of choice is impedance. In impedance, we get B-type curve. Now we have to manage the patient. So we have to manage the patient. Then we are giving drugs to the patient. So what are the first line drugs which we are giving to the patients? The first line drugs are anti-allergics, so that fluid formation in middle ear will not occur. Decongestant, if there is any blockage in the pathway, it will get open. We have to give antibiotics. We have also given antibiotics in ASOM, that is acute suppurative otitis media, but we have to give higher doses. High dose of antibiotic we have to give in serous otitis media because biofilm formation has occurred. Biofilm formation has occurred. We can also do a maneuver which inflates the Stachyon tube. Maneuver to inflate Stachyon tube. The maneuvers are Valsalva or Toynbee. Valsalva or Toynbee. There are many other types of maneuvers, but Valsalva and Toynbee. Valsalva is best. Suppose if medical management fails, then what we can do? We have to do surgical management, but there is an indication when to do the surgical management. The surgical management is done when serous otitis media does not get resolved after 3 months of medical management. When the serous otitis media does not get resolved after 3 months of medical management, and there is hearing loss of more than 25 decibel in both ear, then we have to do the surgical management. And the surgical management, we know it is myringotomy. We give radial incision. In tympanic membrane in antero-inferior quadrant. If you remember, I have told you in acute suppurative otitis media that we are giving curvilinear incision. In posterior inferior quadrant. Okay. Now we have given radial incision in antero-inferior quadrant. But it may happen that tympanic membrane gets healed by itself, and we don't want the tympanic membrane to get healed by itself, because if tympanic membrane gets healed, then again the serous fluid accumulation will occur in the middle ear, and we don't want that. Then to prevent the self healing of the tympanic membrane, we insert grommet. Grommet is inserted in serous otitis media. Okay, so now we have completed our serous otitis media. Thank you.